you know, I mean, it's not so much. To answer your question, I see there are certain, like for example, like there are certain types of infections, especially upper airway, untreated infections that can go and become meningitis, and those are more common in this type of year, this type of season. But really, it can happen anytime. You know, like I've seen it all.
Back in the UK, we used to have a lot of outbreaks at the beginning of every university year when people were moving into the area, bringing in new bacteria that people weren't necessarily used to.
That's absolutely right. Closed quarters, that's where we get the outbreaks. Closed quarters, living quarters, Bill?
I was reading about something yesterday, I think. There was like a big somewhat outbreak of it, not from close quarters or anything, but like a pharmaceutical company is shipping like contaminated steroids or something, and they've had over 450 cases of it, and 67 people have died already. It's probably going to be a big, you know, news thing once they figure out exactly what the deal is. But they said the plant was inspected, and they had standing water, mold, like
so bacteria,
all sorts
it's
of
dirty.
Stuff,
Almost like, exactly. And certain bacteria are more likely to travel to the brain and cause the infection there. That's why a lot of these things can happen this way. So, what does it mean for us? Well, you know, again, when we talk about meningitis, and I know you guys did this in 132, so some of this, again, is a little bit of a review. But you remember we talked about Koenig's sign in 132? Did you talk about that? And Brudzinski's? Sound familiar?
Yeah, one of them's like sit up. The person who sit up.
Okay, who said she knows? Pascal.
Kind of. Go back to what she kind of
Sometimes
Flexing I think the leg, when you
To the hips.
that's Koenig stay on the back.
That's absolutely right. And you know how I remember it? You're right. You want to flex the knee.
Yeah.
And knee begins with, and Koenig begins with, that's how I remember it. So if you're going to flex the knee while they're laying down and their head goes like this, I'm flexing the knee and they go like that, because it hurts too much to stay straight. So I lay them flat, and I take my patient's leg and knee, or the knee, I flex the knee like this, and they're going to go like that. It's painful. That is Koenig's. Okay? What is Brudzinski's?
Flexing, child's laying in a supine position.
That's right. No, that's Bobinski's. No, but you started close. No, you were saying, go ahead.
I don't know.
No, you were right. That's right. So actually, you have them, you flex the neck, and what do they do in response?
The knee goes up. Right?
They actually, exactly. It's the opposite of the other one. So with Brudzinski's, you're actually going to flex the head, and usually it's their toes. Sometimes they're not their whole, but their foot will actually go up like this, or their leg will go up. They will have a lower extremity response. Usually it's like their heel will go up. So when you flex the neck, the heel will go up. Again, we're not like really flexing it hard. We're just kind of having them put their chin to their chest, or we're going to put their chin to their chest for them. So Koenig's is we're lifting the leg or the knee. Brudzinski's is you're flexing the chin to the chest, and they're going to react by bringing their leg up. Does that make sense? So again, other things you can see with meningitis goes back to ICP. So it says things like poor feeding, vomiting, diarrhea, seizures. Again, for children, same thing. Fever because it's an infection. If they start to go into, you can actually see purpura if they start to go into septic shock, which means they're having problems now clotting, which happens in septic shock too over time. It's called DIC, which you probably learned about even with some, they go into like that DIC process too. Lumbar puncture CSF shows cloudy, increased pressure, increased protein, and low glucose when you have the bacterial type. Why do I have low glucose with bacterial meningitis? That's right, very good. And increased protein because the breakdown of the bacteria, it's multiplying quickly, but that breakdown creates protein. Okay, so some critical thinking to think about. And again, how are you going to treat? Okay, so let's talk about that for a minute. How are we going to treat meningitis?
Isolation.
Isolation is important. Very good. Actually, what Romeo said, he said isolation would be my priority. That would be my priority. And people have argued in the past. They've said, why? Because I need to contain. That's right. But I always get those questions. I'm saying like, why am I not giving a dose of antibiotics? Why am I not doing this? Why am I not? No, you're isolating first because you need to protect yourself and you need to protect the other people in the ER or in the community or wherever you find this person you suspected. you need to protect everybody else. And then you can obviously start to do something with them. So isolation in this scenario should be first. Makes sense, right? What were you going to say, Karen?
You have to keep the lights down.
You want to keep the occurrence, yeah, you want to keep it contained. So if I had to do priority, it would be isolation here.
So it's just contact precaution?
Wouldn't it be droplet?
Droplet. Droplet precautions, yep. So we're going to do droplet precautions.
Is that negative air pressure?
Mhm.
Would that be negative?
No, that's airborne.
No, it's not airborne, exactly, it's not airborne.
No, it's just mask.
I see.
No, it's not airborne. It's not like TB or smallpox or,
Just
yeah,
mask them.
exactly, mask, gown, gloves, within 3 feet. Because again, they kind of think like, if the person's sneezing, or how far it will go. And then we're going to treat it based on what's the causative agent. So to get back to, viral is very self-containing, usually not deadly. So in those cases, we're going to treat the temperature. If they have an increased temperature, we're going to give things to treat that. But we're not necessarily going to have to do a lot in like it's really keeping stimuli to a minimum, environmental stimuli, lights low. And they usually get better after 3 to 4 days, and definitely after a week, it's 7 to 10 days. Now, if it's bacterial in nature, which is the very aggressive kind, and they do go downhill very quickly, then we're going to give antibiotics. And usually within like 24 hours of antibiotics, they start to improve, and they're not infectious anymore. And the key is you want to keep them from going into septic shock, because once they go into septic shock, their prognosis is very poor.
That's what I was gonna ask. What would be the prognosis of it? Because I know someone who was in a child specialized hospital for 10 months because of that meningitis. I'm not sure if it was bacteria. It's in the last
So it's probably. What happens with bacterial meningitis is that they start to go into septic shock, which can actually start to cause multiple organ failure. It also starts to clamp down because everything gets shunted to the core, to the major organs. So a lot of their limbs, like their hands, their feet, they start to get like decreased circulation, so then they can actually have, some of them lose fingers, lose hands, lose legs, lose feet. So they need rehab for that. It becomes like a traumatic brain injury afterwards too, because of anoxia to the brain due to such widespread infection. So these things you want to. So in summary, critical thinking. The school nurse sends home a letter stating that a male high school student has been diagnosed with meningococcal meningitis. The nurse recommends the parents to be watchful, but not overly concerned. The letter advises to watch children for 2 weeks and contact the physician at the first sign of illness. Good, bad? Any thoughts about this nurse's letter to the parents? Not good. Sylvania, you don't like it. Why?
because they want to treat.
It is the nurse's responsibility. Obviously, this is something that's reportable to the Department of Health. It's also reportable to all the parents and all the families whose child might have been exposed to it. That sometimes they will even quarantine if it was something like a university setting.
The vaccine, is it for bacterial and viral or viral?
Bacterial.
It's for bacterial.
Yeah. So, okay, so if I'm going to be treating this way, what am I going to do? Well, you're going to want to quarantine, possibly give antibiotics. And if it's a school setting where they might just have come in contact with them, well, then what do you want to tell them in this kind of a letter? What to look for? Headaches, tiredness, put it in their terms too, right? Increased fever, and then what am I going to do for it? Usually schools that have this kind of thing, like Princeton University, they're having education sessions. They're having clinics, so people can come in, they can get tested, they can get free antibiotics. Things like this, prophylactically.
So are these people that, like this case where it's a high school student, like that would have had to get a vaccine already, they got it anyway?
Well, that's a
Or they
good
didn't
point.
have the vaccine?
They didn't have the vaccination, which many people opt out of this or do not get it. That's what's going on with a lot of these vaccinations, actually. That's why we're still seeing these cases.
I thought in schools, like, the school districts, basically, if they've started any vaccinations, they need to have all the vaccinations. They can't just start opting out randomly. I know my school district, I think they start 6th grade, they will not let them stay in
Yeah, they
school
won't
unless
do
they
12.
see evidence of them.
Yes, 12 years old is when they're recommending this now. It used to be 18, now it's 12. And you have a good point, yes, they really do want to try to keep them out of anything, but there are children who go to school that do not have all their vaccinations. But the schools are not.
Opt-outs, or the religious opt-out for these kind of vaccines?
Any vaccination can have a religious or medical opt-out. Any vaccine, it's like, why are people still not having flu vaccinations? You know, why do people still, you know, like, so, you know, again, it's, you know, it's ideal to try to, you know, encourage it, but, there are schools that are not as strict with it as others.
Because it's not one of the major, immunizations.
Well, now it is. Now it is. Now, yep. Yeah, now it is one of the ones. It used to be optional if you were going away to college, and now it's become at age 12, everybody's going to get it. So that is the other point too, Stephanie, because it was only recently, it's been changed to age 12. I think in the past, I want to say 5 years. In the past 10 years, it was this optional thing, you know, at 18 if they were going to go away to college. So there are adults, like I've never received this vaccination. I mean, there's a lot of adults that have not received this vaccination. There's a lot of people have not. So I mean, the incidence is still going to be there.
Should we get this when we work in the hospital? Does that mean we should go get it at this point?
I mean, it's not mandatory at this point because it is more on the rare end. But if you're, and usually by the time you get to the hospital, you're using all your precautions so you know it. So not necessarily for working in the hospital. If you were like a camp director, or if you're running a camp or doing something, then I might recommend, then I would think it would be something that you would think about. Close quarters, lots of people living together. But it's like, you know, you're not going to worry about TB necessarily by working in the hospital, though we do check, because you could be exposed to it. But usually with this, when they come in right away, people are gowned up, gloves, masks, so you're a little bit better off with that. But I would say if you're going to definitely work in areas with lots of people, close quarters, think about it. Okay, well, thank you.
Can you clarify the diagnosis?
You can answer, I'm just going to stop actually.